So I have patient 6. This is a female with history of a humeral fracture, and she also has chronic bicep tendonitis in the left upper extremity. So she has a limited pain-free range of motion in the shoulder and elbow. So the contraindication precautions I've already gone over. She has no open wounds, history of cancer, or gross edema. And the technique I'm using first is deep friction massage, right to the upper biceps tendon or the head of the biceps tendon. So for this, we're using a small, accurately localized, deep penetrating movement across the long axis of the muscles, so the transverse movements. And we're going to be using the fingertips of the index and middle finger, as this is a very small area. For large areas such as the back and legs, we could be using the thumb pad. And generally perform for 5 to 20 minutes. And for the rationale for this, we're creating local damage to the tissues, which will liberate a histamine-like substance along with other metabolites. These will directly act on the capillaries and arterioles to cause localized vasodilation. And in a sense, this vasodilation will bring in more oxygen and nutrients to the area, as well as remove metabolic waste, which will promote a increased healing rate on the tissues in this spot. So at the end of this, we'll end up doing RPM, or relaxed passive movements. I'm now going to be doing the relaxed passive motion, which is going to be 3 to 4 movements of the joint in each of its available ranges. So I'm starting off with flexion extension. We're going to be going to the ends of the active range of motion and giving a little bit of overpressure. The reason we're doing this is to perform a slow stretching movement throughout the available range, repeated several times to increase the degree of motion, using the overpressure to stretch out all of the soft tissues and help restore lost ranges of motion, as well as maintaining normal tissue length and viability. So after the flexion extension, we would go into horizontal ABD and adduction, as well as internal and external rotation. And then we would follow that with elbow flexion and extension. And after that, we would be done, as the target is the bicep tendonitis.